Well, you probably never heard of someone purposely spraining their ankle, but Kelly Osbourne apparently did. She tweeted a picture after she had to make the choice between a bum ankle or doing a face plant into a public toilet.
This is a tough choice, one I hope that no one ever has to face. But in today's edition of Doc Hollywood, I sat down with Dr. Peter Cole, an orthopedic surgeon at Regents Hospital, to find out if that sprain is actually worse than a break and why sometimes surgery is needed instead of a cast. Hey everybody, I am here with Dr. Peter Cole, an orthopedic surgeon at Regents Hospital. Hi Dr. Cole, nice to see ya.
Hello.
We're going to start with Kelly Osbourne today. She is on the mend. She sprained her ankle in a public restroom. It is kind of an amusing story, I would say. She said on Twitter her foot got stuck in a drain, so she had the choice, either sprain your ankle or fall and hit your face on the toilet. She made the choice that I think I would make too. She went for the sprained ankle. Bummer for her. But what's the difference between a sprained ankle and then actually breaking something?
A sprain is actually when you tear a ligament. A fracture is actually a break in the bone.
So can you tell by the pain level whether it's a sprain or a break that you're dealing with?
There are certain sprains that can hurt just as much as a break in the bone. To determine whether something is sprained or completely torn or actually fractured is to go to your physician and get x-rays and then interpret all that in the context of your injury.
Last week, Dr. Cole, Minnesota Timberwolves forward Kevin Love, said his right hand is doing a little better. He had surgery in January, had to repair 2 broken bones. So you're a fracture specialist, that's what you work on the most. Which determines if someone needs surgery on a broken bone or you just need a cast to heal it up?
We have the option to treat broken bones without surgery because bone heals itself by regenerating new bone, unlike, say, the heart or liver or skin, which fills in the gaps with scar tissue. Bone actually fills in the gaps with new bone. So that gives us the option to treat things with either a cast or a splint. But there are times when we would decide to do surgery, and that would be based on either the location of the fracture, the amount of displacement, where it is in relation to a joint or whether it enters the joint, sometimes the age of the patient. In the case of Kevin Love, obviously the demands are as high as they get. So that would certainly influence our decision for surgery.
Does it take longer to recover after surgery or if you're using a cast to heal your bones?
There are situations in which a cast treatment would allow a bone to heal faster, but there are other situations, other types of bones or types of fractures in which surgery would actually help to expedite the rehabilitation process.
And Dr. Cole, I heard that you do some pretty incredible work overseas. What kind of stuff are you working on?
It's an orthopedic outreach ministry to patients that are in need of my type of expertise in the Amazon region. Imagine a region where there are no orthopedic surgeons, a population, say, like the Twin Cities with no orthopedic surgeons. That means we see and have the opportunity to treat thousands of patients with crooked bones that were never treated in the first place.
That's got to be incredibly rewarding.
It is.
Thanks so much for your time, Dr. Cole.
You're welcome. It's great to be here.
Nice to chat with Dr. Cole, and we want to thank Regents Hospital and Health Partners Clinics for sponsoring the show. You always want to check with your physician if you have a health concern too, but he does some great work in I mean, just unbelievable. He brings teams of surgeons down to help.
Well, he looked like he uniquely was enjoying that moment too, talking about it.
I think so too.
Well, you can vote for next week's Doc Hollywood topic at TwinCitiesLive.com. Queen Elizabeth, Lena Dunham, and Ashley Tisdale are your options.
There you go. More TCL to come. We'll see you in a minute.